Welcome to Sante Lakay, a coffee talk podcast brought to you by Zanmi Lasante. I'm Corley Noisette, the Director of Development and your host. I'm thrilled to welcome you to this new series where we'll be joined by experts and leaders across Zanmi Lasante's departments and sites. In each episode, we'll be joined by those on the front line of healthcare in Haiti, sharing insights, challenges, and successes across a range of health topics impacting our communities. From managing health programs in rural areas to responding to public health crises, our leaders will give you a close-up look at the work happening every day to improve lives. So grab a cup of coffee, sit back, and join us for candid conversations about health, resilience, and hope, right here at Sante Lakay. Today with us, we have Dr. Reginald Fils-Aimé, who's the Director of Strategic Planning at Zanmi Lasante. Dr. Fils-Aimé oversees activities including research and strategic information at ZL. He is a Haitian physician who graduated from the State Medical School of Haiti and has a master's degree of medical sciences in global health delivery from Harvard Medical School. Over the past 16 years, he's worked with Zanmi Lasante, the Haitian sister organization of Partners in Health. In addition, he worked with Partners in Health Liberia, successfully serving patients in several clinical areas. Serving more than 10 years within Zanmi Lasante's mental health program, he has been one of the key leaders of the design and implementation of a successful comprehensive mental health program, which has become a national model of healthcare in Haiti. After leading PIH's mental health program in Liberia for almost 2 years, Dr. Fils-Aimé returned back to Zanmi Lasante to support governmental relations in Haiti before stepping into his role as director. Today, Dr. Fils-Aimé will share his unique perspective on what makes Zanmi Lasante successful in healthcare in Haiti and how the robust partnership with the Haitian Ministry of Health contributes to its impact. Thank you so much, Dr. Fils-Aimé, for your insights on the past successful collaborations between the Ministry of Health and Zanmi Lasante. And so, although ZL has made some great impact in the healthcare sector in Haiti, we know working in Haiti is not easy. So, can you speak about some major challenges ZL has faced in collaborating with the Ministry of Health, and how have we overcome this?
Yes, thank you for this question. I'd like to start by stating that the government is the sovereign authority on health system and has also the duty to fulfill the obligation um, that is in the Haitian constitution to provide health care to the population. And our aim at ZL is to contribute to that, to the vision of the government and the public sector more generally. And we finish, for example, and I mentioned also how even our strategic plan is, we make sure that it is aligned. We, of course, we have our own values, but we make sure it is aligned with the Ministry of Health strategic plan and the more general development plan for the country. But of course, there are challenges, and one of the challenge is the turnover of representative. I have been in the role of, as you mentioned at the beginning, of government relations, uh, divisional director, and we need to build this relationship is very important for us, and we need to have it. We need to keep that relationship. But if there are turnover of staff at the level of the public sector, then we need every time to
Restart.
rebuild this relationship. And it's there's if there I myself, I like it. There's some pressure in you learning to know some new people, but it takes some time, and then some projects can some work we are doing can suffer from that. So that's one. And then in contributing also to the mission of the public sector uh, with our work, we also want to, alongside the public sector, advocate for more budget and more budget in the national budget for health. And the Ministry of Health, in their document, in many documents, have themselves stated it that there's not enough budget for health. So this is also uh, this is a national challenge, but of course, since we want uh, sustainable and also um, a health system that is equitable for the Haitian people, universal for everyone and equitable. So this is also for us a challenge that we would like to see addressed in the country, and uh, we are ready to contribute alongside the Ministry of Health as they want to advocate for that. And then there are, of course, the political challenges, but in Haiti, especially right now in this time, I think we can we maybe uh, those listening may imagine in situation of political instability how many challenges we can face in terms of to provide healthcare, um, to bring medication from one place to another to all facilities. There are also many other logistics challenges, um, uh, and of course, all types of challenges, psychological, logistic, and organizational challenges that the current crisis is uh, causing.
Thank you. So, despite these challenges, ZL continues to invest in the Haitian healthcare sector. We've recently we made some amazing progress and achievements. Can you share some of these examples?
Yes, and I think that is um, important to say. We mentioned that we've been in Haiti through tough times, and many tough times before in the 40-year history, and we never stop working, and we do whatever we can to keep health facilities open. That's one thing, and but also another. Although it's tough, we keep innovating to find solution to these challenges. That's how the community health worker program was um, developed to go around challenges and find ways to overcome barriers, especially geographic barriers to care, mental health. And so they're all innovations that are being made and or that can inform the national health system, but also health system in other places, in maternal health, in mental health, in tuberculosis, HIV, and in other system. But we have also two example, maybe two or three example. I can quickly mention. We have recently, although we have been having for the last years many problems in um, in Haiti. We have just inaugurated an oxygen plant in Tomon that can produce close to 100 cylinders a day, but is a maximal production capacity, and that's one thing. But also that is a response. Also that is that is a response to challenges because oxygen after the COVID-19 showed the importance of having oxygen, but also having it close to the patients, especially in rural areas. If we are buying oxygen from Port-au-Prince, the capital city right now, it would be very difficult. So if we need to provide quality health care to those in rural areas, we need to build oxygen plants close to the facilities, in rural areas. That's why that was a very important project for us, and we have built now several oxygen plants in the areas where we are working. That's one thing. We have learned also that we need, for civil reason, we need to turn to solar energy, and we have just renovated and put into work one of our biggest in our system, one of our biggest solar energy system for the Mirabale University Hospital that is now supplying more than 60% of the energy of the hospital. So again, this is another key, and we will continue to to develop and install solar energy in all of the facilities or where we are working. And again, I'm saying facilities of the public sector where we are working. We will continue to do that in partnership with the public sector. Those are some, and of course, during the time of crisis, we have responded and developed structures that not only sustained but that are long lasting and that will continue to um, that are contributing to the sustainability but also resilience of the health system. For example, the infectious disease unit that we created at HOM during the COVID-19 crisis. This is a very well built unit that can receive infectious disease, that has isolation structures, and that can receive contagious diseases, for example, but also the building of cholera treatment centers in the facilities where we are working. We have also built they are one of the rare, there are not many, BSL, biosecurity level 3 laboratory in Miabale. There are not many in Haiti. We have built one. And these are really significant contribution to the healthcare system. And right now, those are things that we have already done. But upcoming, we will have in CEMAC a biosecurity level 2 laboratory in CEMAC that we are hoping to inaugurate in at the beginning of next year. We will have an imaging center at at Miabale University Hospital, and where we will have CT scan. We had CT scan in Miabale before, but with that they were dysfunctional, and we are committed to quality healthcare for our patients. We will have an even better imaging center in Miabale to serve our patients. And again, we are building warehouses in remote areas in the towns outside where we are working, because we understand we need to increase our storage capacity. Those are lessons learned from the crisis, and also ways to build resilience of health system. So we will inaugurate also beginning of next year a warehouse in Hesh, in the in the MOH um, in the MOH hospital Hesh. And then maybe one last thing, of course, we are working also with a hospital in Belader in the Haitian border. That is very important for us to also reinforce this hospital, and also build a new hospital, which is a project we are very much looking forward to.
Wow, you named a lot of amazing and significant um, impact ZEO has made in Haiti throughout the years. You know, despite the hardships, I continue to be amazed by what can be achieved in rural Haiti, you know? Um, Super inspiring. So, my next question is, as you reflect back on your tenure with ZL thus far, what has been the most rewarding aspect working with the Ministry of Health, as well as the overall footprint ZL has made in the healthcare sector?
Yes. Thank you. One of the things that gives me some satisfaction to be part of this work really is one, the long lasting the long lasting impact that the way we work, we do things, especially that the Ministry of Health has allowed us to work with them and do these things, so that it allows us to have long lasting impact. The first one is the training of health workers, well trained and qualified health workers for the health system. I think that's one of the first thing that is having a long lasting impact. Although there are many challenges in migration, but the same challenges made it even more necessary to continue this work of training health workers for the health system. So that is a key contribution to the health system, and that I am proud to really be contributing to this. And a second aspect is when we work with the Ministry of Health, and all of the work we're doing, when we're improving, for example, energy system, when we're improving the spaces, we this is the work that we are doing in the uh, public health system. That will stay there, and that will have long lasting impacts for the care of the population. But and you know many of the other things. Maybe it's important also to mention the feedback we are receiving from those we are serving, from the communities we are working in, and but also because of our values, and because the organization has always tried to push boundaries. And maybe one thing I did not mention, the young people, whether they were young people in the communities, whether it was um, Père Fontaine or Paul Farmer or Fayadal, and at the, at the beginning of the organization, really, they were people who were optimistic about the world and wanted to fight injustice. they they saw injustice. They did not want to just pass by and say, "This is not my business," and I'm letting this. And they wanted to do something about the injustice that they were witnessing. And I think that's part of of really the constitution of the organization, which always will force the organization to push boundaries, to find ways to address injustices in the country and in the world.
Thank you so much. No, it's true. ZL and PIH continue to push boundaries. Who would have thought that we would have a BSL level 3 lab in Mirbale, you know, 'cause there's always more to more to be done.
Yes, of course, there's always more to be done. And, and I think that in that sense, the mindset of an organization like Zanmi Lasante, who says, "I'm with you until you don't want me to be with you, but I'll be with you," then I think this is mindset. That's what keep us working as well.
Thank you. So my last question is thinking about the future of healthcare in Haiti. What, in your opinion, what do you envision healthcare to be like in Haiti, and what role does Zamina Sante play in that? And also, what are ZL's plans for future collaborations with the Ministry of Health, and how does that align with the healthcare needs that we do see in Haiti?
This is a good question, but also a big one. And again, I'm glad you bring the Minister of Health in it, because our vision, of course, we always take into account the vision of the Minister of Health. And one of the things that in the national health policy it was stated that the care that was in 2012, and so it dates a little bit this data, but they are stated that only 47% of the population is covered by the formal healthcare system. And that policy and all of the plan that followed that policy, the strategic plan of the ministry that followed that policy, aimed to achieve universal health coverage. This is a goal. This is also one of our vision, part of our vision, to contribute to achieving universal health coverage. It's not, of course, as you understand, it's also a global part of the sustainable development goals. So, but I think even before the sustainable development goal came out, the Ministry of Health and Zanmi Lasante also were working towards universal health coverage because we really believe in healthcare as a human right, that all people should have access to quality healthcare. So that's why that's one key really part of our vision. And second, maybe I can also say personally this is important to me because I come to an area from the countryside where there was where there was no healthcare facilities, and I remember when I had asthma, I was a kid, and my mother would carry me, walk hours, and carry me to a facility in Leogan, in the town of Leogan. So she would have to cross riving rivers. I was a child, but I think because some of these memories scared me, some of what happened scared me with my mother crossing riving rivers with me with asthma. That made me remember these events. So personally, that's important for me to have universal access to healthcare, to have people in rural areas having healthcare facilities with quality where they can go to. And then, so I said access, but also I already said quality because that's another part. If the healthcare is not of quality, you can have the facility there, but people will not come to it because people know when they are receiving bad healthcare, they will not come to the facility. We to have quality also we will need highly skilled trained professionals. The ministry wants that, but also ZL is contributing to that significantly right now in Haiti. And we hope also to continue this partnership um, with the communities we are serving, with the public sector, as long as they want us.
Thank you. Yeah, you touch upon many important aspects that are critical for the future of healthcare in Haiti, and especially about the healthcare professionals and the contributions EL is making to fill that gap. We're definitely seeing an impact in the migration of Haitians outside of the country. I think we've graduated more than 200 residents thus far, and it continues to grow. And just to add about the ACGMI accreditation of HUM, and now 3 of the residency programs, we're making tremendous headway in the realm of medical education, despite the challenges that
Yes.
we face in the country, but it's
Yes.
amazing.
Thank you. Yes, and it's part of the idea to not only people need healthcare, but people need quality healthcare. And if they need quality healthcare, they need really people with standard training, training uh, that have the highest standard in the world. And that's why we make sure the training we provide to the residents or have international accreditation. So, and we think all of our partners, starting with the public sector, the state medical school, the state University of Haiti, the Ministry of Health, through the direction, all of the leaders who lead training in the Ministry of Health, and also, but also of our donors that allow us to do this work that is so important for Haiti. But also, I think this is a work that can inform the similar needs elsewhere in the world.
Thank you so much. Unfortunately, that's all the time we have for today's episode of Sante Lakay. I just want to say thank you, everyone, for tuning in to today's episode. We hope you found that the conversation on Zanmi Lasante's history and partnership with the Ministry of Health was insightful and stimulating. And a big thank you for Dr. Fiseme for joining us today.
Thank you very much, Kurabi. Thank you for hosting this.
Yes. So if you enjoyed this episode, please subscribe to our newsletter, podcast, leaving us a review, and share with your friends. Also, don't forget to follow Zanmi Lasante on our social media, our Twitter, Instagram, Facebook, LinkedIn. Stay tuned for the next episode of Sante Lakay. Trust me, you don't want to miss that.